Before patient contact, wash your hands. Hi, I'm Caitlin. I'll be your student physical therapist. Can I have you verify your name and date of birth?
Aaron Flagle, December 10th, 1984.
Nice to meet you, Aaron. So today we're going to be going through our growth, range of motion, and manual muscle screening. So what that's going to be entailing is you going through various motions. I'm going to be applying resistance, and I'll have you just try to hold the position against the resistance, okay? Start by having the patient place their hands behind them for support. So first one, we'll start with this leg. So you're going to bring your knee up and down and back to my hand. Don't let me move you. Good, and we'll do the same on this side. So up, down, back to my hand. Don't let me move you. Good. Now I'll try to pull it up. Don't let me pull it up. Okay, and this side, don't let me pull it up. Okay, can you bring your knees together? Bring them apart. And don't let me push them together. Good. Can you bring them together? Don't let me pull them apart. Good. Are you able to bring this ankle to that calf? Don't let me push it. Okay, are you able to bring this ankle to this calf? Good. With this leg, can you go out like that? Good. Don't let me push it in. Okay, and same thing here. Okay, are you able to take this knee and extend it all the way out in front of you? Can you bend at the knee slightly? Don't let me push it down. Okay, same thing with this leg. Extend all the way out, bend slightly. Don't let me push it down. Okay, are you able to bring those heels back towards the table? Okay, and bring it back to normal. Don't let me pull it out. Same thing here, don't let me pull it. Good. Are you able to take the bottoms of your feet, turn them towards each other, and now away from each other? Hold that position, don't let me move you. Okay, don't let me move you. Okay, and back towards each other. Hold. Good. Now I want you to put your toes down towards the floor and up towards the ceiling. Don't let me push it down. Don't let me push it down on this side either. Okay, and can you point your toes at the ground? Don't let me pull it up. Same thing here, don't let me pull it up. Okay, are you able to scrunch your toes? Don't let me move them. Don't let me move your toes on this side. Good. Are you able to spread your toes? And don't let me push them together. Good. And keep it in that position, and I'm gonna don't let me push them down, okay? Good. Good. Okay, now we're going to be doing a manual muscle test of your hip flexion, specifically the iliopsoas muscle. So what I want you to do is take this knee and try to bring it to your chest and back down and back up to my hand. I'm going to apply resistance and I want you to hold, okay? The patient was able to move through the full range of motion and hold against maximum resistance. Therefore, the grading for this is a 5. Okay, so now we're going to be doing a manual muscle test of your knee extension. So what I want you to do is take this leg and put it straight out in front of you. Now I'm going to have you bend slightly at your knee, and I'm going to be applying resistance. Try to keep it there, okay? The patient is able to move through the full range of motion and hold the test position, but unable to hold against resistance. Therefore, the grading for this is a 3. Next, we will be doing a manual muscle test of the gastrocnemius and soleus muscles. The patient is instructed to put 2 fingers on the table, lift his left leg and try to come up on the tippy toes of his right foot. When he is not able to do so, he's then instructed to lay down on his stomach to test this muscle at a 2 grading. Once the patient is lying down and prone, they are instructed to put their foot into plantar flexion by doing a motion that's similar to pressing on a gas pedal. Then resistance is applied. Since the patient is able to go through the full range of motion with gravity minimized against resistance, the grading for this manual muscle test is a 2. Next, we will be doing 2 muscle length tests. For this test, you'll want to first properly align your goniometer. The fulcrum for the goniometer will be at the lateral epicondyle of the femur. The proximal arm will be at the lateral midline of the femur towards the greater trochanter. The distal arm will be at the lateral midline of the fibula. The test is performed by lifting the patient's lower leg off the table and watching to see if the hip moves off of the table into flexion. This is done several times. The knee is being flexed to 90 degrees, but it is very evident that the hip starts to raise before that 90 degrees is met. Therefore, we can take a measurement when that hip starts to raise. We can estimate the angle and then make sure that the goniometer is properly aligned for the measurement. Be sure that the goniometer is aligned properly with the fulcrum at the lateral epicondyle of the femur, the proximal arm still down the lateral midline of the femur, and the distal arm still lateral to the midline of the fibula. Then the recording can be read. The goniometer reads 76 degrees. Because the patient was unable to make it to 90 degrees without flexing the hip, they are positive for the Ellie test. Next, we will be doing a muscle length test for the gastrocnemius. While the patient is standing, the goniometer is adjusted. The fulcrum is at the lateral aspect of the lateral malleolus, the proximal arm is at the lateral midline of the fibula, and the distal arm is parallel to the lateral aspect of the 5th metatarsal. The patient is then instructed to move into the testing position with their knee fully extended, maintaining their heel on the ground. Once the patient is in the proper testing position, the goniometer can be realigned using those same landmarks, and a measurement can be taken. The goniometer reads 18 degrees, which is within normal range of motion for muscle length testing the gastrocnemius. Before range of motion for external rotation and internal rotation can be taken for the hip, a towel must be placed under the patient's leg to ensure that the femur remains straight. To begin range of motion for hip external rotation, be sure to align your goniometer properly. The fulcrum will be the anterior aspect of the patella, the proximal arm will be parallel to the floor, and the distal arm will be anterior midline of the lower leg. The patient is then instructed to do active range of motion of hip external rotation. The goniometer is realigned using those same landmarks to take the reading. It is adjusted as needed. The goniometer reads 24 degrees of hip external rotation, which is within normal range of motion. Here we will be measuring inversion at the tarsal joint. First, you'll want to align your goniometer. The fulcrum of the goniometer will be at the anterior aspect of the ankle, midway between the malleoli. The proximal arm will be the anterior midline of the lower leg, and the distal arm will be the anterior midline of the 2nd metatarsal. Once it's properly aligned, you'll instruct the patient to actively evert their foot. Once it is everted, you'll realign the distal arm to be along the anterior midline of the second metatarsal, and then you will take the reading. The goniometer reads 18 degrees, which is within normal range of motion for eversion. Now we will be doing passive range of motion for hip internal rotation. The goniometer is aligned in the same way it was for hip external rotation. The fulcrum is placed at the anterior aspect of the patella, the proximal arm is parallel to the floor, and the distal arm is anterior to the midline of the lower leg. As I'm sitting, I'm able to passively push the patient's leg into hip internal rotation and use those same landmarks in order to take a reading. This shows that there is 15 degrees of hip internal rotation. This is within normal range of motion. First, you'll want to properly align your goniometer. The fulcrum will be the anterior aspect of the ankle midway between the malleoli, the proximal arm will be at the anterior midline of the lower leg, and the distal arm will be the anterior midline of the second metatarsal. The patient is then passively moved into inversion, and the goniometer is realigned using those same landmarks. A reading can then be taken. The goniometer reads 30 degrees, which is within normal range of motion for inversion. After patient contact, wash your hands.